So now let's discuss pulmonary embolism. This is a relatively common finding that's seen in patients presenting with chest pain. This represents thrombi that travel to the pulmonary arteries from other parts of the body. They can be of any size and they can be located within any of the pulmonary artery branches. A common location for them to travel from is the deep venous system of the lower legs. So if a patient has what's called a DVT or a deep venous thrombosis in the lower legs, they should be scanned for a pulmonary embolism because it's very common for these DVTs to travel up to the lungs. So let's take a look at this radiograph. We see what it looks like an area of consolidation in the right lower lobe. So this is an example of what's called a Hampton's hump, which is a peripheral wedge-shaped opacity that actually indicates pulmonary infarction. However, radiography is actually very limited in terms of its sensitivity in detecting pulmonary embolism. You can have pleural effusions. You can have what's called the Westermarck sign, which is a radiolucency distal to the obstructed pulmonary artery. But these are all very vague findings and nothing really definitive to help you diagnose a PE. CT is really the modality of choice, and it really has to be performed with contrast. It can demonstrate a filling defect within the pulmonary artery. So as you can see here, you have filling defects within the right-sided pulmonary arteries in the patient that had that chest x-ray. And then this is the area of consolidation that we saw on the chest x-ray, which represents a pulmonary infarction. But if a patient can't have contrast, if the patient again has renal failure or has a contrast allergy, an alternative is a ventilation perfusion scan or a VQ scan. And this is a type of nuclear medicine scan that compares the ventilation and perfusion images throughout the lungs, and it shows you areas of abnormal perfusion or mismatch. So you can see here, the top two images demonstrate normal ventilation, and the bottom two images demonstrate perfusion, which has an area of a defect in the lower lung on the right. So this represents a mismatch, and this is an example of a pulmonary embolism. Pulmonary artery hypertension is not very commonly seen, but when you do see it, it's important to identify it. It can be primary or secondary, so secondary causes include mitral stenosis, recurrent PE, CHF, or it can be caused by emphysema or fibrosis, any type of chronic lung disease. And it results in pruning or dilatation of the central pulmonary artery with very small peripheral vessels. So you can see this example on this radiograph where the central pulmonary artery near the hilum is quite enlarged, and then you have kind of a radiolucency in the peripheral aspects of the lungs because the pulmonary vessels are much smaller than would be expected. This is an example demonstrating pulmonary artery hypertension versus a normal. And you can see the difference in the two. So again, you can see there's prominence of the pulmonary artery on the right, which looks much more prominent than it does in the normal chest x-ray. The normal chest x-ray demonstrates sort of a grayish appearance to the lungs, while in a patient with pulmonary artery hypertension, you actually have a blacker appearance to the lungs, again, because of lack of peripheral blood vessels.